Good morning or good afternoon, everyone. Today I'll be presenting a topic that connects common food with common medications, the interactions between selective serotonin reuptake inhibitor, SSRIs, fluoxetines and sertralines, and grapefruit juice. I'm Nuraina Natasa, and let's dive into how these combinations could affect the body in ways we may not expect. So my name is Nuraina Natasa binti Muhammad Sah. I'm from Pharmacy Part 2, Class B1, and my student ID is 2024649628. So the topic that we're going to discuss today is about the introductions between the interactions of SSRIs and grapefruit juice, and also the mechanism of action, special considerable points, and the clinical consequences of between the interactions of those two. Let's start with the basics. So what is drug-food interactions? So drug-food interactions, it refers to any change in a drug effect when taken together with food, drinks, or maybe beverage. So mostly drugs are effective, but some drugs are barely effective, while others can become more or less effective or become even more dangerous for the drugs and the food to interact together. As you may know, food can affect the pharmacokinetics of the drugs, so the food can influence the absorptions, the distributions, the metabolism, and the excretion of the drugs. So for the absorptions, the food can enhance or reducing how well the drug into the bloodstreams. And for the distributions, the food can indirectly affect the protein binding or maybe change the drug distribution slightly or but not significantly. And for the metabolism, the foods can induce or inhibit the enzymes, mainly in the liver and in the intestine. And lastly, for the excretions, it can alter the kidney functions or urine pH and even distribution, so that usually minor. So now the specific case we are discussing are the mechanism of interaction between the SSRIs, which is selective serotonin inhibitor, fluoxetine and sertraline, and the grapefruit juice. So now we're gonna look how the mechanism of interaction between the SSRIs, which is selective serotonin reuptake inhibitor, and the grapefruit juice. So the grapefruit contains furanocoumarins, which is in the grapefruit. So furanocoumarins inhibit an enzyme called CYP3A4, found mostly in the lining of the intestine. So this enzyme helps break down many medications, especially SSRIs. So when the enzyme is inhibited, more of the drugs enter the bloodstream. The plasma of the bloodstream become more permeable, so the drug will enter and maybe at the same time increasing the drug plasma concentrations, and also it will increase the blood levels high or maybe even dangerous level. So let's go through the four pharmacokinetic phases affected. First is absorptions of the drugs. So grapefruit can decrease the first pass metabolism, so more drugs will reach the bloodstream, and so the drug in the bloodstream can be increased. And second is distributions. Distribution may give small indirect effects but not major by inhibit metabolism by CYP3A4, so it can lead to higher plasma levels. And the third one is metabolism, which is CY3AP inhibitions may slow the breakdown of drugs, so it results to inhibiting or inducing liver enzyme. And lastly, we have excretion. Excretion might slightly impact, but mostly related to liver and kidneys. So it will affecting the renal or biliary eliminations. So why is the interaction between the SSRIs and the grapefruit juice is dangerous? So with sertralines, grapefruit juice can lead to high drug levels, increasing risk of side effects like nausea, agitations, or insomnia. Toxicity such as heart rhythms, problems, or kidney issues. In extreme cases, serotonin syndrome. Serotonin syndrome is a potentially life-threatening condition caused by too much serotonin in the brain. So while fluoxetine is less affected, but the caution is still recommend for the patients to take to monitor. So this is some of the real case study between the interactions of SSRIs and the grapefruit juice. First, we have vital study, which is the lab test. They use human CYP3A4 enzymes, and it shows that grapefruit juice inhibit metabolism of sertraline. And second, we have vivo study. They use human patients. So the study on 5 patients shows that after just 1 week of grapefruit juice, sertraline levels increase significantly. So the conclusion that we can get from both of these real case study is which grapefruit juice does interfere with SSRI metabolism and maybe can raise the risk of side effects. Here's what healthcare providers should advise to the patients, or the patient have to avoid or modify, such as avoid grapefruit juice or fresh grapefruit while taking sertraline. And maybe fluoxetine is less sensitive, but regular consumption should be discussed with the doctor first. And keep a consistent diet. Like do not suddenly introduce grapefruit juice in your routine when you are taking the sertraline or maybe fluoxetine. And monitor symptoms like confusions, nausea, or sleep problems. And never ever adjust the dose without consulting a doctor. Like you want to lower the dose or maybe high up the dose, you cannot do that because it will cause higher rates of side effects. So this the alternative drugs that we can take with grapefruit juice instead of taking the SSRIs, which is escitalopram and citalopram. This is the special precaution and monitoring that we can do. So if we are taking the SSRI levels and grapefruit together, we have to monitor for sign of increased SSRI level or maybe some sign of nausea, confusions, or heart problem. And if you take SSRI and grapefruit together, you have to inform all the healthcare providers so they know what to do, and maybe keep a symptom diary. And as the diet modification, we cannot just adjust the dose by ourselves. We have to consult with the doctor. To wrap up these presentations, grapefruit juice inhibits the CYP3A4 enzyme, leading to higher SSRI levels, especially with sertraline. So this raises the risk of side effects, toxicity, and serotonin syndrome. Also, more research is needed. This advice is very clear, which is to avoid grapefruit juice while on SSRIs and always consult your healthcare provider about your diet. I think that's all from me. Thank you. That's the end of my presentations.